Perhaps outside of most childbirths, going to the hospital is generally a scary place. It is usually a place most people want to avoid. Imagine that you are Ellie. You were diagnosed with renal disease when you were just a few years old. You've been living on the wards at Moi Teaching and Referral Hospital in Eldoret, Kenya. Your parents can't stay with you because they live far away and need to continue working to provide for you and your siblings. Ellie's day-to-day support on the wards are child life specialists like Martha, working with him to prepare him for medical procedures, serving as an advocate to medical teams, providing school lessons and the opportunity to just be a kid, and providing support to his parents and siblings. Imagine being Martha, a child life specialist with this huge responsibility as your job. The reality of the patients and child life team show this urgent need for a stronger system of support for those providing care. And in particular, this part of the health workforce, who is providing essential services, but not typically top of mind when you think of health provider or health worker. Additionally, child life is a workforce that is made up of largely women. Working with our child life team at ANPATH, it became clear to me that addressing these challenges and the barriers they face require empowerment to lead, advocate, and innovate within the healthcare system. Hi, I am Kristin Srour. I currently serve as Associate Director of the Indiana University Center for Global Health Equity and the ANPATH Consortium. And I am so fortunate to be on this WomenLift Health leadership journey. As I look at my own children, I see Ellie, who has spent years in the hospital, often without family nearby. He relies on Martha for connection, support, and love. The bond that he and Martha have is profound. It's really a lifeline during his most difficult moments. But beyond that lifeline, there are immense challenges. Specialists like Martha often face limited resources. This includes lack of therapeutic materials, which can make it challenging for her to provide the level of care she's aiming for. There's a high patient to specialist ratio that leaves them stretched thin. Hospital policies can hinder their full ability to serve families. And on top of this, they often encounter resistance or misunderstanding about their role from other health providers or families. And as you can imagine, cultural and language barriers exist to connect with families. This is all while the emotional weight of working with critically ill children can lead to burnout and compassion fatigue. Yet, despite all of this, these specialists continue to show up. Martha shows up with hope, compassion, and resilience. Their dedication is unwavering, but their pathway is filled with many obstacles. Through my journey with WomenLift Health, I recognized an opportunity to partner with these incredible child life specialists to collectively strengthen their leadership and advocacy skills. This group of health professionals does so much with so little. My project aims to amplify their voices, support their growth as leaders, and drive change within the hospital and healthcare system through their leadership. Through my experience with WomenLift Health, I learned that authentic and inclusive leadership isn't about taking charge. It's about empowering others. It's about partnering to co-create conditions where lived experience and expertise become the driving forces for meaningful change. And understanding the role that I play within this. My project focuses on co-creating a program that provides leadership and advocacy skills for these incredible child life specialists. This is meant to enable them to expand their impact beyond what we see today, creating this ripple effect. Through leadership development, mentorship, and advocacy, we can unlock new possibilities. Through this project, we are going to conduct leadership training workshops to build leadership skills and advocacy skills. We're establishing mentorship programs to connect child life specialists in Kenya with global leaders in psychosocial care. And we have a long-term goal to integrate the child life program more deeply into the healthcare system. These efforts are creating a ripple effect, empowering these child life specialists as leaders who can advocate for systemic change. The project is about more than addressing immediate challenges. It's about preparing child life specialists to lead. These professionals are on the front lines. They are uniquely positioned to identify gaps, to advocate for change, and to shape a healthcare system that truly meets the needs of children and families. So, by building their leadership and advocacy skills, we're empowering them to take on a larger role in driving systemic improvements. The vision for the Sally Test Child Life program is to become a center of excellence for psychosocial care, training future leaders and expanding access to child life services across sub-Saharan Africa. This is about equipping child life specialists not just to care for children, but to lead efforts that transform how care is delivered. Every child deserves dignity and hope. Every caregiver, like Martha, deserves the tools and support to lead with impact. It is possible to build a more compassionate healthcare system, one that doesn't just react to challenges, but redefines what's possible. This can be achieved through leaders like Martha. And an asante to WomenLift Health for amplifying that these possibilities exist. Thank you.